Number two here is measles, and we're coming back to the
Measles.
United States here.
Mm-hmm.
Now, we know that the big outbreak that started a lot of the measles concern and conversation this year was in Texas earlier this year. But I think what's been less understood is that that outbreak eventually seeded outbreaks all throughout other parts of the United States, particularly in the Southwest. And you're seeing a very large and growing epidemic in Arizona and Utah. And so far, you have over 1,500 measles cases in the United States this past year. Now, the United States is a country that we had previously announced and been very proud of, eliminated measles. That means there was no more transmission occurring only within U.S. borders. Everything was caused by importations. But we're really in danger of basically losing that status as cases continue to spread in other places around the United States.
The only thing that's going to keep these numbers down and even get us back to eradication is consistently high rates of vaccination. And as long as we have these pockets and communities that dip below that protective threshold of 90s, 95% that we need a vaccination rate, or up there in the 90s, we're going to be susceptible to these outbreaks and ongoing transmission. Measles is just one of the most infectious viruses, Jay.
It is. And I think, the things that I've been, talking about a lot, you've been talking about, so many of our colleagues in public health around the country, is the importance of vaccination and the fact that we are losing this battle. And I am really worried about the school season, right? Kids are now back in college. They're back in their daycare, et cetera. This is the time when kids are now all congregating together in schools. And as the weather gets colder throughout most parts of the United States, people spend more time indoors. This is the absolute worst time to be entering school in a place that has low measles vaccination rates.